All day we've been looking at how Brexit will affect health and the NHS, including the supply of vital medicines. Lots of people got in touch to ask questions, and we've been speaking to Layla McCay, the National Health Services Confederation Director of International Relations, and Danny Mortimer, co-chairman of the Cavendish Coalition and chief executive of NHS Employers, who tried to answer your concerns. All day we're looking at how Brexit will affect health and the NHS, including the supply of vital medicines. Lots of people have been getting in touch to ask questions, and joining us now in the studio to hopefully answer them to everyone's satisfaction, Layla McCay, the National Health Services Confederation Director of International Relations, and Danny Mortimer, co-chairman of the Cavendish Coalition and chief executive of NHS Employers. Welcome to you both. Just a general question first. How much of your time is being spent thinking about contingencies for Brexit?
I certainly spend a very large chunk of my day, whether it's thinking about how we can make sure that we get a good deal for health for Brexit, or whether we're thinking about how can we make sure that the NHS is as prepared as possible for all eventualities.
Danny, are you equally occupied?
It's probably slightly more all-consuming for Layla, but it does take up a fair bit of time, and I think particularly over this last 12 months as there's been quite a lot of work to do around the government's migration policy and how that impacts upon us post-Brexit, it's been really important.
Layla, first question to you from Cassandra FBPE on Twitter. Can type 1 diabetics be assured their insulin will be readily available?
I think this question of medicine supply is going to be one of the most noticeable impacts that we're all thinking about in health. And, you know, if the withdrawal agreement is to go through, then things will continue pretty much as usual. So yes, you would expect that supply to just continue as it currently does. In the event that the withdrawal agreement doesn't go through, then we find ourselves in all sorts of different scenarios, with the no deal scenario obviously being the most extreme end of that. And in that case, there will be probable interruptions to the supply of all sorts of different medicines. And that's because, you know, there'll be delays at the border, there might be regulatory differences that have to be introduced, all sorts of different things could happen. So the government is making sure that there's going to be this continuing supply through a variety of mechanisms. I think the one we hear most about is stockpiling. Obviously there's all sorts of different medicines that maybe can't be stockpiled, but the government is developing different ways of making sure they come in. And you know, a lot of that relies on industry being able to stockpile these medicines, and we hear that there are some challenges to that. But what I think is important to know is that we have worked with industry to make sure that these concerns have been fully understood by the government, and they are now coming up with further contingencies.
Danny, on staffing, from Simon Burgess in Cumbria, he emailed to ask, can we make departing NHS staff pay back their training costs?
I guess there's a couple of things there. I mean, I think the first is, I guess what lies behind the gentleman's question is, why is the NHS in this position? Why does it have such a demand for staff and we can't fill the vacancies within the country? Clearly we've got some challenges in terms of keeping people. We no longer pay for the training of nurses and other healthcare professions, and we only pay for a small element now of the medical school costs of doctors. So I think that's changed now in line with all university courses. But the simple fact is that our demand for people has grown quicker than we thought it would. And our demand for people has grown quicker than the plans of the government until recently in terms of investment in our services. So we've struggled to keep pace with actually the increase in emergency care that we've seen, the demand for our emergency services, which I think was touched on in Milton Keynes earlier today. We've struggled to keep pace with the fact that actually we're all living longer and we all need more care. And that's in part why we need to bring people in from outside the country, as well as try and keep the people we've got already.
Danny Mortimer.